Hope you're all doing fine. So in this video, we'll discuss various important topics in orthodontics, right? So coming to the chapter on growth and development, right? So in growth and development, try to focus on the following topics. Percentage growth of cranium, maxilla and mandible at different age groups like 0 to 5 years, 5 to 10, 10 to 15 and 15 to 20. So what would be the percentage growth of cranium, maxilla and mandible? So we have one question from this topic in NEET 2013, right? Remodeling theory of craniofacial growth asked in AIMS 2012. Growth of maxilla and growth of mandible asked in AIMS 2003. Lip thickness asked in AAPG 2014. Differences between cartilage and bone in terms of growth, right? So we have interposition, apposition type of growth asked in COMET 2014. And also topic on anterior arch width, right? Anterior arch width, we have a question from this topic in GSET 2014. And assessment of skeletal age based on cervical vertebrae asked in AP 2015. And adolescent growth asked in PGI 2011. Stages of embryonic craniofacial development asked in PGI 2012. Maturation of oral functions like respiration, swallowing, deglutition, speech, etc. asked in AAPG 2015. Population height charts, where we have a graph of the height versus the time interval. So we have a question from that in AAPG 2015. Growth of mandible, as I said previously, growth of maxilla and mandible. And factors influencing dental arch form asked in AIMS 2015. And also we have a question on Singer's method of age assessment asked in MHPGSET 2016, right? So these are some of the topics which you can focus on, especially in growth and development, right? And then coming to dentition, development of dentition and occlusion, you try to focus on the following topics like midline diastema asked in PGI 2011, various stages of tooth development, important in pedo as well as in ortho, NOLA's stages of tooth development asked in AIMS 2012, leeway space, AAPG 2014, Baum's classification of primary molars, right, and early mesial shift, incisal liability, intercanine dimension, safety valve mechanism to control mandibular growth. This intercanine dimension, right, asked in MSET 2014 and also AP 2014, right? So these are some of the topics which you can focus on, development of dentition, right? And then coming to etiology of malocclusion, also pertaining to development of normal occlusion and classification of occlusion, try to focus on the following topics. Angles line of occlusion asked in PGI 2013, Karnataka 2013, vertical malocclusions, COMET 2013, column angle, AIMS 2013, self-correcting anomalies in children, AIMS 2013, Salgeman's classification of malocclusion based on skeletal structures asked in AAPG 2014, speech or phonation difficulties associated with various malocclusions, PGI 2011 and 2013. And also lot many questions on etiology of malocclusion, which include thumb sucking, tongue thrust, and how to correct these anomalies asked in AIMS 2013, NEET 2013, COMET 2015, bruxism, COMET 2012, malocclusion, which is progressive, right, AIMS 2012, suckling reflex, infantile reflex, and also mature swallowing pattern. So we have these terminologies asked in AIMS 2012, COMET 2015, etc. And clinical features of mouth breathing asked in COMET as well as GSET 2016. Diagnosis of mouth breathing, like we have this butterfly test, mirror condensation test, and also water holding test, and ugly duckling stares asked in COMET 2016, right? So these are some of the topics which you can focus on, malocclusion as well as development of normal occlusion, right? And coming to diagnosis, so diagnosis, you need to focus on various analysis. So we have this mixed dentition analysis, Moyer's analysis, Ashley and Ho's analysis asked in AAPG 2015, AIMS 2013. Objectives of orthodontic diagnosis asked in COMET 2013. Various skeletal maturity indicators, SMIs, like Fishman's index asked in NEET 2013. Golden proportion asked in PGI 2011. Dimensions of orthodontic study models asked in AIMS 2014. Oblique, 3/4 or 45-degree photographs and their importance asked in PGI 2011. Microradiography for measuring mineral bone density of mandible asked in PGI 2011. Anatomic portion, artistic portion of orthodontic study models, Comet 2016. And finally, physioprint, a device used to record facial configuration in 3 dimensions of space, asked in AAPG 2015. So these are some of the topics in diagnosis. So this is very extensive. We have a lot many topics, right? If in case you feel bored or if you feel like you're unable to follow, just pause the video, wait for some time, but make sure that you're noting down all these important topics, right? Since it's challenging manually to note down all these points on board and just giving extempore, right? And then cephalometry. So in cephalometry, we have various topics like archeal growth of mandible, ARCIAL, archeal growth of mandible, asked in Comet 2013. Long face syndrome, oral manifestations, asked in AIMS 2012. Interincisal angle, Karnataka 2013. E-line or aesthetic line, AIMS 2013. Tweed's analysis, McNamara's analysis, asked in PGI. Lateral ceph or lateral cephalometry, asked in AAPG 2015. Occlusion, classification of occlusion, right? So these are some of the topics which you need to focus on cephalometry, right? So make sure that you may make a note of these points in your notes. And then biomechanics. Biomechanics pertaining to tooth movement. So we have a lot many questions on anchorage, types of anchorage, types based on the type of force and also based on the number of anchorage units, asked in MHC 2015. Modulus of elasticity of orthodontic wire, asked in AIMS 2014. Alloy, cobalt chromium alloy, asked in PGI 2013. We have also questions on wire size and play or degree. So depending upon the size of the wire, we have different play or degrees associated with those wires. And also we have questions on tooth movement, right? Asked in Comet 2015. Magnets in orthodontics, asked in AAPG 2015. And then coil spring, and also mild and heavy orthodontic forces and the clinical implications, asked in Kerala 2016. Various translatory or bodily tooth movements, asked in AAPG 2015. Loop and helices function, right, asked in AIMS 2015. So these are some of the topics from biomechanics. And then coming to preventive and interceptive orthodontics. So recommended duration of headgear wear, asked in Kerala 2016. Advantages of removable space maintainers, AP 2013. Contraindications of band and loop space maintainers, AIMS 2013. Frankel appliance, Comet 2014. Sequelae of serial extraction, unwanted sequelae, asked in Comet 2015. Crown and loop space maintainers, Kerala 2015. Palatal crib, AAPG 2015, right? Now, coming to various removable and fixed appliances. Cold bend test. So we can have questions from the metallurgical aspect also, right? So make sure that you focus on night eye wires, different types of orthodontic wires, stainless steel wires, alloy, etc., right? So in removable and fixed appliances, we have cold bend test, NEET 2013. Beta titanium wire or TMA wires, NEET 2013. Jessing spring, asked in AAPG. Jessing spring is nothing but universal retraction spring. And also you have questions on dimensions of inner bow or face bow, AAPG 2014. Diagram based questions, like you can have a bracket placement. So bracket placer was asked in AP 2015, right? So you can even have a lot many diagram based questions, especially these appliances and all. Appliances for correction of single tooth crossbite, asked in Comet 2015. Length of tongue spikes in a device like Holly's appliance with tongue grip or tongue crib, right? We have this crib to prevent this tongue thrust habit, right? So what is the length of the tongue spikes in tongue thrusting habit breaking appliance, asked in MHC 2015. Australian wire, asked in AAPG 2015. And elastics, asked in MHPG set 2016. Twin block, AP 2016. Quad helix appliance, AP 16. Beg appliance, Kerala 2015. Mushroom arch wire, PGI 2013, right? So these are some of the topics in removable and fixed appliances. And also we have, most importantly, myofunctional appliances. Myofunctional and orthopedic appliances, where we have questions from functional regulator, Karnataka 2013, Herbst Appliance, Karnataka 2013, Goals of Growth Modification, AP 2014, Distraction Osteogenesis, right, AP 2014, Contraindications of Functional Appliance, Comet 2015, Pressure Exerted by Lip on Maxillary Incisors, PGI 2011, Occipital Pull Headgear, Comet 2015, Activator Headgear, Comet 2016, Bionator, which is the modified activator, Comet 2016, right? So these are some of the important topics in myofunctional and orthopedic appliances. And finally, we have treatment planning. So in treatment planning, aesthetic appliances for orthodontic treatment, Comet 2013, drugs affecting orthodontic treatment, PGI 2013, Adjunctive Orthodontics, Comet 2013, Twinning, 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 which comes in phase transformation, right, AIMS 2012, Moyer's classification of malocclusion, AIMS 2013, occlusion with familial inheritance, AIMS 2012, tooth positioner, right, for final setting of teeth, PGI 2013, mini aesthetics, AP 2015, bioprogressive therapy, PGI 2014, laser debonding, PGI 2014, permissive occlusal splints, AAPG 2015, and various categories of root resorption following orthodontic treatment, AP 2016, right? So these are n number of topics which we have in orthodontics, and we have a huge list here, right? So try to focus on these topics initially and then go ahead with other topics as well. Practice as many multiple choice questions as possible, and regarding standard books for reference, we'll discuss that in the next video, right, along with the weekly schedule. Hope it's clear.